In this procedure, you will learn standard precautions for removing contaminated matter from instruments in preparation for disinfection or sterilization. Because of the potential for splashing of infectious material, put on an impermeable gown and face shield or goggles and mask. This is called personal protective equipment, or PPE. Put on a pair of disposable exam gloves followed by a pair of utility gloves to protect against potentially infectious matter and sharp instruments. To prevent injury and exposure to infectious matter, separate the sharp instruments from other instruments to be sanitized. Discard the sterile drape into a biohazard container. To help remove debris and prevent coagulation of body fluids, rinse the instruments under cold, running water. Never allow blood or other substances that can coagulate to dry on an instrument. Microorganisms can hide under contaminants and may not be destroyed by the disinfection process. So open hinged instruments and scrub all grooves, crevices, and serrations with a disposable brush. Rinse well with hot water to remove all soap and contaminant residue. Towel dry all instruments. Do not touch the paper towel dispenser as you are obtaining towels. Touching the dispenser with the soiled utility gloves will contaminate the dispenser. Dry thoroughly, as wet instruments can rust or become dull, and water on instruments can dilute disinfectant or sterilization chemicals. Dispose of contaminated towels and the disposable brush in a biohazard waste container. To remove any possible contaminants, take off the gloves and perform a medical aseptic hand wash. To prevent exposure to contaminants, towel dry your hands. Dispose of all towels in a covered biohazard waste container. Put on disposable gloves. Decontaminate the utility gloves and all work surfaces using disinfectant cleaner to prevent transmission of infectious organisms. Dispose of the contaminated towels in a covered biohazard waste container. Properly remove and dispose of PPE in a biohazard waste container, and sanitize your hands. Place sanitized instruments in a designated area for disinfection or sterilization to prevent possible cross-contamination.